Welcome to this presentation on drugs acting on the autonomic nervous system. Professor Govind Narayan Purohit, popularly called gnpsir, will discuss the main principles, the classification of drugs, their mechanisms, and their clinical applications in veterinary practice. The autonomic nervous system, or ANS, controls involuntary body functions like heart rate, digestion, and respiration. It has two main divisions: the sympathetic nervous system, often called fight or flight, which prepares the body for stressful situations, and the parasympathetic nervous system, or rest and digest, which conserves energy and aids in digestion. Most organs receive input from both systems, a concept called dual innervation, allowing fine-tuned control. Together, these systems maintain body homeostasis, keeping internal conditions stable despite external changes. This picture explains the autonomic nervous system and its classification of the sympathetic and parasympathetic nervous system. The autonomic nervous system communicates with target organs using specific neurotransmitters and receptors. In the parasympathetic system, the primary neurotransmitter is acetylcholine H. Acetylcholine acts on two types of receptors: nicotinic receptors and muscarinic receptors. Nicotinic receptors are further divided into NN, neuronal, found on postganglionic neurons, and nanometer, muscle, found at the neuromuscular junction. Muscarinic receptors, numbered M1 to M5, are present on various target tissues and mediate most of the parasympathetic responses, such as slowing the heart rate and stimulating digestion. In the sympathetic system, the main neurotransmitters are norepinephrine, NE, and epinephrine, AP. These act on alpha, alpha-1, alpha-2, and beta, beta-1, beta-2, beta-3, adrenergic receptors, which are distributed on different organs to produce effects like increased heart rate, bronchodilation, and vasoconstriction. Understanding which neurotransmitter acts on which receptor is crucial for predicting the effects of drugs acting on the ANS and for clinical applications. Parasympathomimetics, also called cholinergic agonists, mimic the action of acetylcholine to activate the parasympathetic nervous system. They work by stimulating muscarinic and sometimes nicotinic receptors, producing responses similar to the body's natural PSNS activity. Some key drugs and their clinical uses include bethanechol, stimulates the bladder muscles, helping with urination in cases of urinary retention. Pilocarpine reduces intraocular pressure, making it useful in treating glaucoma. Neostigmine enhances muscle strength by inhibiting acetylcholinesterase, which is particularly helpful in myasthenia gravis patients. It's important to remember the side effects, often summarized by the mnemonic sludge: salivation, lacrimation, urination, defecation, ghee upset, and emesis, which reflect overstimulation of the parasympathetic system. Understanding these effects helps predict both therapeutic benefits and potential adverse reactions of these drugs. Parasympatholytics, also called anticholinergics, work by blocking acetylcholine at muscarinic receptors, thereby inhibiting parasympathetic activity. This leads to effects opposite to those of parasympathomimetics, such as increased heart rate, decreased secretions, and relaxation of smooth muscles. Some clinically important drugs include atropine, increases heart rate and reduces secretions, making it useful during anesthesia to prevent excessive salivation and bradycardia. Glycopyrrolate has similar effects to atropine but is longer acting and does not cross the blood-brain barrier easily, which reduces central nervous system side effects. Caution in veterinary use: some anticholinergics can cause adverse effects in certain species. For example, horses are particularly sensitive, and anticholinergics may induce colic. Therefore, they should only be used when absolutely necessary. Understanding these drugs is critical for controlling parasympathetic activity in clinical settings and predicting species-specific risks. Sympathomimetics, also called adrenergic agonists, stimulate the sympathetic nervous system, producing fight or flight responses such as increased heart rate, bronchodilation, and vasoconstriction. They act by activating alpha and beta adrenergic receptors, depending on the drug and target tissue. Key drugs and their clinical applications include epinephrine, a critical emergency drug used in cardiac arrest and anaphylaxis. It stimulates both alpha and beta receptors, causing increased heart rate, vasoconstriction, and bronchodilation. Albuterol, terbutaline, selective beta-2 agonists used as bronchodilators, particularly for treating feline asthma and other bronchospastic conditions. Dopamine, used in cases of shock or low blood pressure during anesthesia, supporting circulation by stimulating beta-1 receptors in the heart and alpha receptors at higher doses. Understanding the receptor specificity of these drugs helps predict both therapeutic effects and possible adverse reactions, making them essential tools in both human and veterinary emergency medicine. Sympatholytics, also called adrenergic antagonists, work by blocking the activity of the sympathetic nervous system, preventing overstimulation of alpha or beta receptors. By doing so, they reduce fight or flight responses, such as elevated heart rate, vasoconstriction, and increased cardiac workload. Some important drugs and their clinical applications include prazosin, alpha-1 blocker, relaxes the urethra in cats with urinary obstruction, improving urine flow. It acts by blocking alpha-1 mediated smooth muscle contraction. Propranolol, atenolol, beta blockers, slow the heart rate and reduced cardiac workload in cats with hypertrophic cardiomyopathy, HCM. By blocking beta-1 receptors in the heart, they prevent overactivation and excessive cardiac stimulation, helping manage arrhythmias and cardiac strain. Understanding the receptor specificity of these drugs is crucial for predicting their therapeutic effects and possible adverse reactions, and for safely using them in clinical veterinary practice. This table summarizes the drugs acting on the autonomic nervous system, ANS. Cholinergic drugs mimic parasympathetic activity. Anticholinergics block it. Adrenergic drugs mimic sympathetic activity. Adrenergic blockers inhibit it. Indirect acting drugs work by increasing neurotransmitter levels. Ganglionic and neuromuscular blockers act on nicotinic receptors, ganglionic for ANS, neuromuscular for skeletal muscle. Remember the simple pattern. Drug right pointing arrow receptor right pointing arrow effect right pointing arrow use right pointing arrow side effects. Focus on high yield examples for exams. Thanks for watching. Share, like, and subscribe gnpsir classes official.